So I'm here with Dr. Liz Lipsky, who's a doctor of nutrition, clinical nutrition, and I have Dr. Jane Giltonen, who is a naturopathic doctor, and I have Dr. Tierna Lodog, who is a medical doctor and herbalist. And we are going to give you guys some wisdom from these fine doctors. How do you discuss spirituality with patients? I think particularly for younger practitioners, this is a difficult thing for them to know how to broach with their patients. So how do you?
Well, you don't think about it as spirituality.
Okay.
That's the first thing. Just take that off the table, because that's where people get tripped up. Ask people what gives their life meaning. Like, what gives your life meaning? Why do you think you were born? What is your purpose in the world? Like, what makes you uniquely you, that just you are here for? And people begin to talk about that, and it's like, is my family important? Is my job important, my career? But people begin to self-identify then. So for me, it's not so much a matter of asking, are you religious? Are you spiritual? Sometimes I'll ask things like, what do you turn to when times are really hard? When like you feel like you've really hit the wall or hit the ground hard? Like, what gets you through those hard times? And that's another way people then begin to speak about what's important to them. Sometimes they may bring in their faith, or they may bring in family, or they may bring in connection. So I think that a lot of times what we're trying to get at is what gives somebody, what is that something that infuses us, that lets us connect to something outside of ourselves. And don't get hung up on religion and spirituality. I think that's where everybody gets confused. Ask about purpose, ask about meaning, ask what gets you through the really, really tough times. How have you gotten through that in your life? That really opens up a lot of wonderful conversation too. And I think it's far more than asking people about, do you go to church?
Good, so you changed the question, nice job.
Yeah.
Yeah, good.
It's true.
It's good, absolutely, it's perfect.
So how did she change the question?
Well, she said it's the wrong question.
Yeah.
Well, okay.
Thank you for that.
I'm going to agree with Dr. Lodog. And early in my career, there was a question on our intake form that says, do you have a spiritual practice? And then they answer, then you talk about it. And I found that to be a very unsatisfying question and a very uncomfortable one for many people, because spirituality is often mixed up with religion. And I tossed that question out of the intake form. And it really is more about what gives you passion? What is meaningful to you? What is your spirit? Where do you find spirit? Sometimes I'll do a very short guided imagery with a patient to help, to ask them to create the space that they feel the most alive in and the most meaning from. And then I send them home to do that as a practice every day or 3 times a week. To me, that's spirituality. But you get away from that piece of religion, which can be it may be the place for some people, but it's not for many people. So I don't use the word spirituality.
Okay, good.
I also don't use the word spirituality in my practice. I might ask somebody, when do you feel most connected? What motivates you? Where do you find a place to revitalize yourself when you're low? Where does that impetus come from? Because I think it's so individual. And then there are other people that I've worked with, and their religion or their spirituality is right out front, and it's a conversation that they want to have, and just being open to the fact that they want to have that conversation and being willing to listen and hear about their way of spirituality is really important. For me, every moment is a sacred moment. This moment is no more or less sacred than any other one. So when I'm sitting in a room, it's more about how I am than about trying to pull something out of them. Because I think when we're calm, then people can feel calm, and when we're really paying attention, then they'll open up in ways that are unexpected and really magnificent.
Wonderful. Thank you all.